In this video, we are going to go through breathing techniques for an easier labor process. The minute you're in labor, if you start implementing these techniques right away, it's going to make for less painful experience with the contractions. It's going to help keep your nervous system in a parasympathetic rest and digest state, which is going to help you stay in active labor. If a tiger was chasing us and our nervous system went into a sympathetic state, then we would not stay in labor and our bodies would not deliver these babies. If there's external threats, that's going to keep us more in the sympathetic state. So we want to do everything possible to stay in the parasympathetic state. We want to have pain management with this type of breathing, and we want to help baby descend into the birth canal with a lot more ease. I'm Dr. Allison Felt, and I am so excited to share with you the breathing techniques that will help you bring baby into this world without a lot of stress and strain and injury on your body. To get started here, I need to teach you how to do a diaphragmatic breath. With this diaphragmatic breath, you are going to use your diaphragm to help push down on the top of the uterus, which is going to make your contractions more effective, helping open up the cervix, helping you dilate through the labor process. So here is how we're going to do it. After we do that, we are going to then translate into doing a diaphragmatic breathing with pelvic floor opening. So you can help open and relax your pelvic floor so then your uterus can do its job of pushing the baby out. Join me here as we do a diaphragmatic breath. We're going to place one hand on our bellies and one hand on our chest. You're going to take a nice deep breath into the hand on your belly. Take a nice deep breath in. Belly expands. Exhale and let it go. That's a diaphragmatic breath. Do that again. You see the hand on the belly is what's rising, not the hand on the chest. You want the air to go into the belly and fill as much space as possible without forcing the breath into the belly. So you gently fill the belly. That is a diaphragmatic breath. And let it go. We're driving the air down towards the belly because what that's going to do is it's going to help us open up the pelvic floor. And again, I already mentioned that type of breathing is going to help stimulate your vagus nerve, stimulating the parasympathetic rest and digest, relaxed nervous system, which is going to help keep you in active labor. This is also going to help you manage the contractions more. So if the contractions are becoming uncomfortable, the more you can do this type of breath into the contractions, the more you're going to make them comfortable. Then you can also use a little brain technique where you just tell your body, these contractions feel really good. This is exactly what should be happening. And you start to pattern in your brain that these contractions are the exact thing you want happening and that they feel good and pleasurable and not painful. So that's the first step. Second, now we're going to move on to our diaphragmatic breathing with our pelvic floor opening. So what that looks like is when you think about the pelvic floor, if you are thinking about your anus or your vagina right now and you squeeze those shut like you're trying not to fart or you're trying not to pee, that is doing a Kegel. And when we do that kind of Kegel or that kind of contraction, we are closing the pelvic floor. For labor, delivery, and birth, we need everything open. So how do we start opening that muscle? Well, you need to connect to it with your breath. It's great to practice this before you go into labor itself. It's like trying to run a marathon without training. You want to train your breath, train this type of breathing, connect it to your pelvic floor, so then you're prepped for the birthing experience. You're going to do this type of breathing. We're going to deep breath into our bellies. Diaphragmatic breathing, air goes into belly. Exhale and let it go. On the next inhale, I want you to connect down to your pelvic floor. And instead of doing a Kegel, I want you to try and open the pelvic floor. And if you imagine that your vagina is a rosebud and you are trying to blossom all the petals of the flower, so we can see all the petals of the flower, and then as you exhale, you're going to get a natural recoil. So let's do that together. Deep breath in. Air goes into belly. Pelvic floor opens and elongates. Exhale and let everything go. If it's easier for you mentally to connect to your anus, you can connect down to your anus. So think about on the inhale, everything goes into the belly, the air. Anus is flaring open. Exhale, you're going to get some natural recoil. This is the breathing technique that you are going to want to implement through the entirety of your labor. Even when you start to get Braxton Hicks contractions and you're not in active labor, I challenge you to start doing this type of breathing, because when you start to do this type of breathing, when you start to feel things abdominally, your body's going to know to go back to this type of breathing. This type of breathing is absolutely essential, because when you inhale, that diaphragm is then pushing down on the top of the uterus, which is going to help drive baby down deeper into the birth canal, which is then going to help open pelvic floor, and you're using your breath, this muscle, as an assistance in order to bring baby down. Now it's the uterus's job, the uterus, that pushes the baby out. Big uterine contraction allows the cervix to open. Once the cervix is 10 centimeters dilated and fully effaced, meaning that the tissue is just really thin and open, then baby can slide out of the uterus, and then those contractions start to move the head down through the actual cervix itself. If the cervix is fully dilated and baby's having a hard time getting through a really tight pelvic floor, this is a problem. And that's why we have to use this type of pelvic floor opening breathing to get the baby through the birth canal. Now, if you have a really tight pelvic floor, it's absolutely essential that you start doing this type of breathing before you go into labor, because a very tight and contracted and shortened pelvic floor makes it really hard for the uterus to push the baby through. So it's really advantageous to do a lot of pelvic floor opening work, and that's what we do at Body Motion. We have the Body Motion birth preparation protocols where we help open up the pelvic floor itself, creating new lengths and coordinating your breath to the pelvic floor, so that when you are in labor, baby can just slide through the birth canal and doesn't have to work through the cement resistance of the pelvic floor, or of a tightened or shortened pelvic floor, or of a pelvic floor that's never been really taught how to move appropriately. The very least that you could do is to start breathing, opening, and coordinating your pelvic floor so that baby can start to breathe down the birth canal and then slide out of the body. Now, when you get that very deep rectal pressure, where you feel like I am gonna poop no matter what I do, that typically means that you're 10 centimeters dilated and the baby is at the lowest station possible where it's ready to come out. Now, the issue is that a lot of times people are just going based on what the doctor checks them as, and they're 10 centimeters. And don't get me wrong, they want this to be over, so they're like, yes, let's start pushing now. But if baby isn't low enough or deep enough and pelvic floor is not relaxed enough, it's gonna be a very long pushing experience. We need to make sure you're ready for that pushing experience. And you really, even if you're 10 centimeters dilated, you want to wait until you have such an intense urge to poop that you just can't even feel like you can hold the poop in. That's when you know you're ready to breathe your baby out through the birth canal. And when you start to use this type of breath pattern to move the baby down through the birth canal and then to open up the pelvic floor, you don't have to change your breath pattern. It's the same exact breath pattern to help breathe baby down and out through the birth canal. Now, you might use some vocal or glottal tones to help open up the pelvic floor deeper and help get it more open, especially if it's not opening or you're having a hard time breathing baby down through birth canal. A couple of those deep sounds will help open up the throat. So like, if you talk really deep, you're gonna feel those deep opening sounds, and you should feel that deep opening in the vagina as well. The sounds that you make of your throat, if it's really high pitched, are gonna cause the vagina to narrow and become tight, because that's what high pitched voices do. They narrow the vocal folds, which is gonna narrow the pelvic floor. If you talk really deep, it's gonna open the vocal folds and it's gonna open the pelvic floor. So that's why we suggest using deep sounds as you're pushing baby out, and that also makes sure that you're not holding your breath. If you hold your breath, that's just going to create a lot more potential for there to be pelvic organ prolapse and perineal tearing. And so we want to use those deep sounds in order to help move baby down through the birth canal and push baby out. So deep sounds can be in the form of a grr or a moo, and you just need to play with what works best for your body and where you feel the pelvic floor opening pain the most. So again, more advantageous to start practicing this before you're actually in active labor, transitioning into pushing phase. So I hope you found these breath patterns helpful, and I hope they can help get you into a really good rhythm to help manage the contractions, progress your labor, and help breathe baby out. Please like and subscribe and share this with all your pregnant friends. We love supporting birthing people and women to help bring their babies into this world so they can protect their bodies and decrease the risk of tearing, decrease the risk of prolapse. We are here for you. Body Motion Physical Therapy, located in Edmonds and Poulsbo, Washington. We do intensives where people fly here to prep for their delivery. They come for 4 to 5 days with us, and they go through intense pelvic floor opening and balancing, so then baby can be ready to just slide through the birth canal when they go into labor. I'm Dr. Allison Felt. Thank you so much, and good luck to the birth of your dreams.